the 3rd of July, 2023. Already we're in the second half of 2023. How far with your goals? What happened? Let us know. 055-556-1034. We're going to have a conversation in the BFS clinic on infertility in women. So stick by your phones, by your TVs, and put this number down for you to send a message. 055-556-1034. 055-556-1034. My guest is Medical Director and CEO of Nature's Green Medical Centers in London with a consulting office right here in Accra. His name is Dr. Richard Eghan. Good morning. Welcome to the show. Hope you had a great weekend.
Oh, very one.
Awesome.
Very big one.
Awesome.
It's been very, very stressful and
yes,
tiring,
Well, I know you know how to balance it out.
Of course.
Indeed.
I'm trying my best.
Let's talk about infertility. General description of the term, and then in women.
Right. So when we talk about infertility, at least we can only understand the concept when we define fertility. So fertility is when you are able to, when a couple are able to actually conceive or have conception within a period of 6 months to 12 months, then we say that at least they are fertile. The opposite is actually true of infertility. That is, if a couple actually cannot actually have conception within a period of 12 months after having been exposed to unprotected sex for that period,
okay,
then we say that this couple are suffering from infertility problems. Yep.
And then let's narrow it down to infertility in women. What are the causes? Why does it happen?
Well, first of all, a woman's reproductive, because we can actually answer the question without actually explaining what the reproductive system is about. We have the fallopian tubes, which are two, and we also have the ovaries in the woman. We have the uterus or the womb, and also we have the endocrine system aspect, which is the hormonal aspect, the estrogen, progesterone, and then we come to the brain where we have the pituitary and hypothalamus that actually will produce certain hormones. So basically, this is what the reproductive system of a woman is composed of. Now, as you can see on the screen, to talk about causes, we need to, as you see over there, we have the tubes. The tubes are where the egg that is produced or released during ovulation actually is released into the fallopian tube, and where it goes to wait for the sperm of the male, which comes in there to fertilize, to form the zygote or the embryo.
So does that mean that when there's ejaculation,
yes,
the sperm shoots up?
It travels.
It travels up, and then it goes to have that meeting with the egg.
Just have to.
If everything is normal.
If everything is more normal, if the fallopian tube is not blocked, you see. So one of the causes of female infertility is the blockage of that tube you see over there. As you can see there on the screen, the fallopian tube blockage can be seen this way. On that side, and then there's also issues regarding something called endometriosis, which I think we'll come to that, and then the uterine fibroids. So these are the things that can actually lead to infertility in women. So if all these things are working, if the tubes are working very well, if the ovaries are actually working, the follicles within the ovaries are producing eggs, and the eggs are actually maturing, because it needs to actually mature before actually it can be able to produce a baby, because we have cases where some women don't even have matured eggs, and these things can also cause serious problems regarding fertility in women.
Okay, let's bring back that picture again of the anatomy of the woman, internal parts. Yeah. Let's bring it. So I want to just find out, of those four causes, the fallopian tube blockage, endometriosis, tubal infection, uterine fibroids, which are the most common for women in Ghana or even worldwide?
Well, in Ghana, I would say that the studies that have been done by Larson, Jechi, and the others in this wonderful country, we see that the majority of cases they came across where women with, egg issues production, and in other words, we are talking about ovulation.
Ovulation.
So we had massive amounts of women that really had problems with ovulating.
Is it that they're not producing enough eggs, or the eggs are not good quality?
That is actually something we can presume, because you realize that the blockages of the tubes were actually another problem, but we realized the ovulation aspect was just big time. And most often we according to research, you can see that these women do have problems with hormonal balances.
Okay.
So when the ovary is not functioning very well, which we realize that most women's ovaries are not functioning well, then it leads to problems with the production
of the eggs
and maturation of the eggs.
What will cause ovaries not to function well? What are women experiencing that is affecting the production of eggs?
In actual fact, you see, the ovaries to function very well depends on factors of the related to the woman's overall health. So if the woman doesn't have problems with ovary functioning, and doesn't also have problems regarding PCOS, because we have cases like PCOS, which are some of the causes. Then we also have problems regarding the hormone itself, which has to be balanced, like estrogen, progesterone. And then there's also something called FSH, follicle stimulating hormones, and another one called luteinizing hormones. So if all these things are working very well, the ovary, in fact, it's a very, very serious situation regarding many women. Ovaries, most women's ovaries don't work, according to the studies that have been done that I came across. So the causes come from different angles, from environmental factors, being exposed to, plastics, being exposed to BPH and other things, so many chemicals.
What's BPH?
Biophenols. They are actually things you can find within the environment, within foods, and also within plastics and so on and so forth. So these chemicals can affect the woman. And also we have, as you can see on the screen, endocrine disturbances. So for a woman to be fertile, first of all, the neuroendocrine, the brain aspect, which help to produce the FSH, follicle stimulating hormones, and the luteinizing hormones, there has to be working very well. They also, so there shouldn't be any endocrine, disturbances. But we have, chemicals within the environment that actually produce what we call the endocrine disrupting activities.
So they affect the endocrine system.
They affect which also play an important role with regards to fertility. So the endocrine must work very well, and then the woman should also, so those are the things that actually can affect the ovaries functions anyway. And then there are also other factors. So apart from the ovary not functioning well, issues regarding, so we are talking about infertility,
yes,
as we continue.
Should we bring the chart back up for you to see?
Yeah, we can.
Let's bring back the chart of the causes of infertility. You spoke about endocrine.
So we've talked about endocrine. We are also talking about congenital anomalies. So things that women are born with. Some were actually born with low, reserves of eggs. You know that once a woman is actually born as a woman, they are given the eggs that they need to be given to have children with already. And then they also have, so if the reserves are very low, it can actually cause, infertility. And then we also have acquired factors. You can acquire so many things from the environment. Too much drinking, taking certain type of nutrition actually plays an important role. And you go to the urogenital infections, which is mostly one of the causes of infertility among women in Ghana, because most women that were tested had what we call the PID, or the pelvic inflammatory disease. And that is also a condition that is actually acquired from STIs or
sexually transmitted
infections or diseases. So unfortunately, most women who have gonorrheas or chlamydias and some of these conditions actually don't have symptoms. And these symptomless sometimes, conditions can actually lead to a whole lot of issues affecting the cervix of the womb.
So it's like a sleeper agent, just lying there quietly. You don't know what is happening, and then
and it is just causing serious problems. It can even cause colonization of certain pathogens or microorganisms such as bacteria, certain types of bacteria that cause gonorrhea, chlamydia, and so on and so forth, and so viruses as well. And then we also have fungi, microbes, also that can also colonize the area, the vagina, and also the cervix. So we are saying this in particular because we know that apart from the ovarian function and the ovulation issues, we know that most women we saw in the research here in Ghana, I read about this, just recently, and we realized that PID is a major problem. Pelvic inflammatory diseases is quite a big issue here. And the reason is that, most people would like to do sex unprotected. And in our society here, childlessness, voluntary childlessness is not there. Like someone to say that, I'm not going to have children. I'm not going to have children. We don't have it over here. So it is very much easier for especially couples who, goodness knows whether they were actually okay in terms of sexual health and then infections, whether they were okay before they even started a relationship. So therefore, they start having this unprotected sex with the aim of, having their children. And sometimes this can lead to a whole lot of things because the man might have some condition that was not treated or was treated partially somehow and may pass it on to the woman. The lady may also pass it on to her systems, the reproductive tract. It goes into the cervix and probably produce a condition called cervicitis, which is an inflammation of the cervix. And also it can even travel down to the fallopian tubes and cause infection there. That could also cause blockages because when it happens this way, then there's something called heterosarpingitis, which is an inflammation of the salpingitis is infection of the fallopian tubes. Most women may not actually notice this. They may not see these things. It can go on for a long time and actually lead to a blockage of the tubes. Now, as I always say, that if the tubes are actually, one is not even functioning and one can function, that's okay. But if the two are completely out, then natural fertility will be a problem. Yeah.
Okay. You're watching the VFS Clinic on GTV Breakfast. My name is Kafi Day. My guest is Dr. Richard Eghan, and we're looking at infertility in women. If you have any questions, please send them to us, all right? 055-556-1034. Let's talk a bit about fibroids and their impact on fertility.
Right. So fibroid is actually one of the causes of infertility in women. And fibroid is by definition a benign tumor. So benign means non-cancerous, something that is not cancerous. So they develop. Actually, sometimes we don't know the causes, but it just comes up sometimes. But we also put it down sometimes to the fact that the uterus itself was not functioning well, and a whole lot of things actually affect the uterus or the womb that cannot be explained. But the only thing to say about these things is they do happen and they are benign. They are not cancerous. You can see them, growing. They can grow very big sometimes, and they can look about 7 centimeters and so on and so forth. Yes, they can grow that big, and even sometimes to the size of the football.
The size of a football?
It can get to that point.
A football-sized fibroid?
Yes. There are cases that,
wow. Are they heavy?
They are heavy because the woman really, you can see that the woman is looking like a pregnant woman. Sometimes the belly grows so big, like somebody with about 3 or 4 or 5 months pregnancy.
And it's just a fibroid?
And because, They are harmful in a way because when they are found in certain areas in the womb, then of course they can cause heavy bleeding, which is one of the symptoms. And it's a major cause of infertility because you see, after fertilization has successfully taken place within the fallopian tubes, the zygote or the fertilized egg must move into the womb through some, natural means, chemotaxis and whatnot. So it has to move from the fallopian tube into the womb, and there is a specific place prepared by nature for the baby, the zygote to actually grow, develop gradually to become a baby in the end. And those are the areas where if a woman has a fibroid, then of course it's going to actually block the implantation of the baby itself. That can lead to infertility anyway. That can lead to a whole lot of issues. It can even lead to the womb or the uterus being, the zygote or embryo being deposited in the wrong place, sometimes into areas which eventually causes that to become ectopic, pregnancy and so on and so forth. So, yes, fibroids are benign. They grow just like babies. The only difference is they don't have life in them. And there are types, different types. There are subserous, fibroids or myomas. And we also have submucosal ones as well. And all these things are actually found within different parts of the womb. But sometimes doctors will tell patients that if the fibroid is found in a place where the implantation, so most women have been told this, those who have the fibroids, that if it is deposited in a place where implantation actually takes place, then of course it's going to be very difficult, if not impossible, for this to happen. But like you're seeing on the screen, we are still looking at the causes over there. Indeed. So the fibroids is one of them. Endometriosis is another, where the cells of the endometrium, which is actually the uterine muscles. So the myometrium is actually the place where we call the muscles of the uterine itself or the womb. And there are certain cells within that area which needs to stay within that area.
And if they don't?
And if they don't and they have to travel anywhere else, which sometimes do happen, then you have conditions like endometriosis. Okay. And those are very, very powerful and painful conditions.
And they affect fertility.
And they do affect fertility as well.
All right, keep the questions coming in. 055-556-1034. This is a question from Amma. He wants to know from you if we have statistics on women with gluten sensitivity, celiac and menstrual disorders in Ghana, and how can such women be helped?
Oh, gluten sensitivity. It's a very, very difficult question, and because gluten sensitivities are things related to nutrition, and sometimes these are things that actually are very serious issues that need to be. They are not easily even identified. They are not easily even diagnosed, and the treatment it takes a whole lot of complicated distinct processes.
Right. We should do a whole show on that one of these days.
We have to do. In fact, we have to do a show,
a whole series on that.
Yeah.
Okay, so now you've painted a picture of what the causes of infertility in women are. Let's have some solutions now. Can all infertility issues be solved?
If someone has fibroids, fibroids that needs to be removed, then they have to be removed.
Is that surgery?
Through surgery. Okay. So we call something myomectomy that can actually be used to remove that. If it is too big and it is in an area where it's difficult to remove, then sometimes they can suggest even partial or full hysterectomy, where sometimes if it becomes very, very severe and serious, they have to remove the whole.
So hysterectomy is a removal
taking away
of
the womb itself.
Okay.
Hysterectomy, it's just to take off the womb where necessary, and that is always the last option anyway, because
that must be a traumatic choice for a woman to make.
It is, but then sometimes the fibroid is so big that not so much can be done. And so they would decide, apart from, the myomectomy, the only option is just probably to remove it.
And I must imagine that you must have encountered women who were very resistant to that option, even though the fibroid was that huge.
Yes, I mean, some of them will tell you that they will just pray about it. They hope that some herbals can do it. They will just go and try, you see. And these blockages also cause a whole lot of these issues with the woman's actually general health. Because if you have fibroid with the size of about football, then it's going to cause a lot of.
Because I must imagine you're putting pressure on other organs.
You are, because it's within there. It is actually putting lots of pressure on the adnexy, the pelvic region, everything. It will affect also the bladder, all the urinary tract and everything. So sometimes even going to urinate is going to be a problem.
Okay.
So we say that at least the first choice will be surgical operation. If it is not too big, sometimes they tell the patient if it's not too big, it can be allowed to grow. And we also know that some children have actually grown alongside fibroid or development. So, but sometimes what happens is if you allow the fibroid to actually grow alongside the fetus, the growing fetus, eventually it can cause a lot of problems because the fibroid is also taking certain proportions of the nutrients that the baby is feeding the baby.
Right. So you're feeding something that
doesn't even have any relevance to anything.
Okay, let's pull up that picture again because I want to go through all those issues and get the solution. So you've talked about the fibroid issue, maybe surgery is important, and then there was also on the diagram blocked tubes.
Yes.
So how do you solve blocked tubes? How do you unblock tubes?
Well, there are, most of the time it actually goes through, and the woman has to go through surgical, they have to remove the tubes.
You have to remove the tube?
Yes, okay. Or they have to leave it. Because sometimes the blockages, it's not easy to actually remove a blockage. I've heard many people talking about, when you take this medication, we have got this herbs here and that herb here, that can actually move it. It's not that simple. And sometimes, because of the infection, there's a lot of water in there, or fluid, put it this way. And this fluid can even travel to places where they call them a pouch of Douglas, and so on and so forth. It becomes a whole mess in there. And we want to remind women that this blockage results from unresolved or untreated sexually transmitted diseases. So if you have been diagnosed with chlamydia, which most women don't get the fortune to actually have that diagnosis with chlamydia or gonorrhea or anything. They don't. Most women will they may be discharging some stuff, but they may not even know what it's actually. But sometimes it's gonorrhea, chlamydia, or vaginitis and all these things, which actually leads to this fallopian tube blockage. In fact, blockages are not easy to be removed, but we know that with modern technology, the removal of, especially if fluid has filled in the area, sometimes they're able to actually remove the fluid and also deal with the infection that is producing those substances, the fluid substances in there, because it is always the infection, the gonorrhea or the chlamydia bacteria that is actually producing whatever it is that is going on within the tubes. So if we're able to kill them and we're able to remove the fluid that is built up over there, sometimes it does happen that the blockage actually goes. But it depends on the level of blockage that is in there. And then two, we want the ladies also to understand that once one tube is blocked, it is possible for the other tube to support conception.
Okay. Briefly, before we wrap up, you said the ovulation issues to do with eggs is like the main problem with infertility. How do you stimulate the growth of more eggs or get more quality eggs?
One thing about the eggs is this. First, the follicles must work very well. The follicles within the ovaries, which actually produce the eggs anyway. But then it also depends on the eggs reserves. So the ovary reserves are good, because every woman or every organism that is born as woman must have their eggs with them. They actually don't. The one thing about the difference between men and women is men continue to produce sperm for the rest of their days. So a man of 70 years can even have a child if they have a good quality sperm. But a woman at a certain age, like from 35 going, if you haven't had a child over 12 months, you have to be concerned. And a woman under the age of 35, if you haven't had a child within 6 months to 12 months, you must also be concerned.
Okay.
Because sometimes the reserves are not many. Some women are giving many eggs, some are not. And every month, if you don't get pregnant, you must know that you are shedding some of these eggs. They are going away.
So time is not on your side.
And time is not on your side because you don't produce them. It is there. You've been given already. That's the difference between a woman and a man. Sperm, you can produce them every time. Your testicles can actually produce them all the time. But for a woman, once you are given the eggs in there, that's it. So certain factors have to work very well for you to be able to actually produce quality ones. You must be healthy. And also, if you are overweight, it can affect the production of the eggs.
Okay.
So firstly, your neural system has to work, the brain aspect has to work, the endocrine system also must work very well to produce the follicle stimulating hormones and the luteinizing hormones, which also stimulate the production of the estrogen and progesterone.
Okay.
All these things actually play a role in your ovulation.
Okay.
Therefore, if all these things are working very well and you are healthy and everything is all right, a woman should be already, what do you call it? Should be fertile and good enough to go.
A couple of quick fibroid-related questions before we go. So Winner B wants to know, is it true that when women stop menstruation, as in menopause, the fibroid ceases to grow? Do fibroids keep growing after?
It does. It will naturally sink or reduce in size.
Okay, so it's related to that. So Mary also wants to know, can fibroids shrink when you are in menopause?
It can shrink because it is only fed by the estrogen and also other substances. So once the estrogen ceases to be produced or secreted, and of course it's very easy for the fibroid to shrink naturally. Okay. So if you had even a big size, with time it goes down.
All right.
Because it's not being fed. It has no nutrition or anything.
Okay.
So yes, that's true.
Where can women and couples find help as far as infertility issues are concerned, especially infertility in women? Give us some hope. Where can they look for hope?
Well, there is hope if you still have your womb. There's still hope if you still have. In fact, the womb is the first thing we think about when it comes to women's fertility or reproductive biology. If there is a womb, then there's a hope. So if you don't have the womb, then there's no hope. Fallopian tubes, even if they are not there,
there's no hope to have your own children.
To have your own children, you have to adopt.
Yeah.
But if you do have the womb and you do have your own eggs, you can produce your own eggs. Even if the fallopian tubes are not there, we can still, technologies are there, ART, the artificial reproductive technologies are there these days. We can also do insemination, artificial insemination to put it there for you.
Okay.
Inside it, you do the implantation, artificially, and, it can go. But once you have the womb, then you have the hope. Let me just put it that way. Once you have the womb, you have the hope.
Okay.
So if you don't have the womb, then don't even think about it. And don't even go and just say, well, let's just pray that maybe God will produce the womb quickly for you to have it. Because it's not that, everything is possible with God. But in this instance, I think it will be very difficult to get a new womb.
Okay.
So you have to protect your womb. You have to protect your fallopian tubes. You have to protect yourself from getting infections, or test yourself periodically to know whether you have some of these infections hidden. Because they are usually hidden in women more than men. Men can see the signs, women can't see it. So you have to be doing these periodic checks. And then you also have to, so if you have ovulation problems, people like myself have medicines and stuff that can be given to you.
How can people reach you? We're out of time.
Oh, well. As usual, we don't have enough time.
Yes, there's never enough time. How do people reach you?
Right. If anyone wants to contact me or see me, I have a small consulting office around Kwashman Junction near the EcoBank. But I only do appointments only. So you can reach me on 0595 0595-234695. 0595-234695. And if you want to catch me on WhatsApp, you can reach me on 057 6300552.
Okay.
057 6300552. And you're good to go.
Thank you very much. Ovarian cyst wasn't mentioned, says Jared from Kaswa.
I know.
It's part of the process as well. So yeah, thank you for reminding us, Jared from Kaswa. That brings us to the end of our conversation on infertility in women. You can catch it on our Facebook page. Go to GTV Ghana and follow the link right there. You will see the video on the top of the stream. Many thanks to Medical Director and CEO of Nature's Green Medical Centers, Dr. Richard Eghan. Thank you so much.
Thank you very much.
All right, we still to come. We have sports at 7 with Matiti Saida Sadiq, social media corner at 7:15 with Jay and Val, and headlines with a certain Kafui Day, sitting down with two politicians to talk about current affairs and all the stuff in the news. Do not go anywhere. This is #GTV Breakfast, show number 501. Hip, hip, hip. All right.